A very big hello to all my dear students. Welcome to the T2O series of your favorite channel, You and I with Dr. Ruchi Rai. What is the letter today? It is O. Many conditions from O. What are we going to learn? Very important, asked in the exam, optic atrophy. So first of all, when we start with optic atrophy, you should know all, I'm not writing everything. If you want to write, you can write down. All nerve fibers are damaged, right? Patient is blind. And what you get is total afferent pupillary defect. That means pupillary reactions are absent. I think this is simple. What they ask you most important is classification of optic atrophy. There are many ways to classify. What we have to follow? You can just learn with me like primary, secondary, consecutive, glaucomatic. We are taking primary here. Primary optic atrophy, as you can see here, you can make a diagram to be very clear, has clear disc margin and chalky white in color. So this is what you see here. It is a clear disc margin and chalky white in color, isn't it? This is your primary. Primary, why do you call it primary? Cause is in the brain. Cause is behind from lamina cribosa till brain. So it is not in the eye. So that is why it is primary. If you talk about the etiology, most commonly it can be due to multiple sclerosis, neurosyphilis, even Leber's hereditary optic neuropathy will lead to primary. Toxic neuropathies, that is nutritional neuropathies, this is also primary type of optic atrophy. And lastly, traumatic. Okay, these are all causes of primary optic atrophy. ठीक है आप the question they will ask you is on morphology. If you look at the fundus, how do you know which type of atrophy? What is the second one? Secondary. Secondary optic atrophy, let us make a diagram here. This is actually blurred disc margin and as you can see dirty white in color. You can see the slide here. It's a blurred disc margin and dirty white. This part has started getting with the atrophy. The other part is still little pinkish. And what will be the cause? This time it is secondary to the optic nerve problem. That is, cause here will be either papillitis or papilledema. Okay, so cause is papillitis or papilledema. Right? What is the third one? Consecutive. What is consecutive? When it is due to retinal disease. Think with me. Retina, all the nerve fibers form the optic nerve. If there has to be any retinal pathology which will lead to atrophy of the whole nerve, that pathology has to be widespread. That is why you have to think of the causes which are widespread pathology like retinitis pigmentosa, as in this case. You see a pale waxy disc. How do you describe it? It's a pale waxy disc. Make the diagram and the clear disc margin, generally clear, don't get confused with these changes. And these, of course, you see the RP, what is the typical triad of RP? These are the bony spicules, pale waxy disc and attenuated arteries. Attenuated arteries means constriction, vasoconstriction of the arteries. Okay? So this is the triad of RP, which is very, very important and you should be clear. Right? So this is what is consecutive optic atrophy. Any other causes, the retinal causes which can lead to optic atrophy? It can be central retinal artery occlusion. It can be many settings of even PRP. All these can lead to optic atrophy. Okay. And what is the fourth type of atrophy? It is glaucomatous. We have learned it in the glaucoma chapter also. It is due to glaucoma. And how do you generally understand this and draw it? There's a CD ratio is much more than 0.7, 0.8, 0.9, whatever. Okay, more CD ratio. Then we talk about nasal shifting of vessels. Okay, so nasal shifting of vessels like this you can show. Then there can be openings of lamina cribosa, lamina dot sign, right? So these are some of the important features which tell us that this is glaucomatous. So here you can see an increased CD ratio. We can even appreciate the nasal shifting of vessels. Right? Okay. And let's now solve the question. These were the four types of optic atrophy. You should be very, very clear about. Talking about the question, chalky white optic disc on fundus examination is seen in all except, let's think, toxic, chalky white is primary optic atrophy, toxic mein hota hai, yes, Leber's hereditary, yes, Post-papilledema, it has to be a secondary optic atrophy, isn't it? Traumatic, yes. So this is the answer. Okay. So that was all for today. Thank you so much. Hope you enjoyed. Stay blessed and keep smiling.